Warning signs of kidney failure. Critical symptoms you shouldn't overlook. Kidney disease is a significant health issue affecting nearly 37 million people in the United States. What makes it particularly dangerous is that symptoms often remain hidden until as much as 90% of kidney function is lost. This means that by the time noticeable signs appear, the kidneys may already be close to failure. Common symptoms like fatigue, swelling, and changes in urination can be easily missed or attributed to other conditions, making early detection and intervention challenging but essential. Understanding these warning signs is crucial for preventing further damage and maintaining kidney health. Controlling kidney disease at its earliest stage is critical, and this requires a keen awareness of the initial signs and symptoms. It's essential to recognize these early indicators so they aren't confused with less severe conditions or dismissed altogether. By understanding these warning signs, you can take proactive steps to manage the disease before it progresses. Let's delve into 13 common symptoms that you should be vigilant about. Fatigue and weakness. Among the most prevalent signs of renal failure are weakness and fatigue. The synthesis of erythropoietin, a hormone that promotes the creation of red blood cells, and other aspects of the body's internal equilibrium depend on the kidneys. Erythropoietin levels decreases with declining kidney function, which results in anemia. Reduced oxygen delivery to tissues as a result of this blood red cells loss resulting in chronic weakness and widespread weakness. These symptoms are frequently mild at its first, but if kidney function continues to decline, they can become incapacitating. When the kidneys are not functioning efficiently, they lose the ability to effectively filter waste and excess fluids from the body. This buildup of toxins in the bloodstream can result in feelings of fatigue and weakness. Furthermore, kidney failure leads to a reduction in the hormone erythropoietin, which is responsible for regulating red blood cell production. While weakness and exhaustion may indicate kidney failure, there are also other possible causes like malnutrition, sleep deprivation, or just plain laziness. Therefore, consider obtaining a full night's sleep and eating a balanced meal before you start worrying about your kidneys. So, it's advisable to see a doctor to be checked out if you think you could have a kidney issue. Foam in urine. One potential indicator of kidney dysfunction is the presence of foam in the urine. Under normal circumstances, your kidneys efficiently filter waste while retaining essential proteins and other crucial molecules in the bloodstream. However, when kidney functions is impaired, this filtering process becomes less effective. As a result, proteins such as albumin, which should remain in the blood, leak into the urine. The presence of these proteins alters the urine composition, causing it to appear frothy or bubbly, a condition medically referred to as proteinuria. Proteinuria is a significant marker of kidney damage, as it indicates that the kidney's filtering units, the glomeruli, are not functioning correctly. It's important to note, however, that foamy urine isn't always a definitive sign of kidney failure. Other being factors such as a high urine flow rate or the presence of soap or other cleaning agents in the toilet can also cause urine to appear foamy. Nevertheless, persistent foamy urine, especially when accompanied by other symptoms like chronic fatigue, unexplained swelling, edema, or significant changes in urination frequency or volume, should prompt immediate medical consultation. These additional symptoms may indicate a more serious underlying condition, such as chronic kidney disease (CKD) or other renal impairments, and warrant a comprehensive evaluation by a healthcare professional. High blood pressure. The kidneys function as the body's regulatory hub for blood pressure. They produce hormones that manage the balance of fluids and electrolytes, which are crucial for maintaining stable blood pressure levels. When the kidneys are impaired, it's akin to having a malfunctioning control center. The essential hormones that normally help regulate blood pressure become ineffective, causing blood pressure to rise uncontrollably. This elevated blood pressure places additional strain on the already compromised kidneys, further aggravating the underlying kidney condition. This creates a detrimental feedback loop. High blood pressure forces the kidneys to work harder, potentially leading to further kidney dysfunction, which in turn exacerbates the rise in blood pressure. Managing blood pressure becomes increasingly difficult, leading to a worsening of both the hypertension and the kidney problem. Breathlessness. Breathlessness can be caused by kidney failure in a number of ways. When the kidneys are unable to effectively filter blood, urea, and other pollutants build up in the blood. Ammonia is created when urea is converted, and this gas can cause symptoms including headaches, dizziness, and trouble breathing in addition to impairing respiratory function. Additionally, anemia, a disorder marked by a lack of red blood cells, is frequently brought on by renal failure. The body needs these cells to carry oxygen throughout it, and adequate amounts of these substances impair the supply of oxygen to tissues, resulting in heightened dyspnea, exhaustion, and widespread weakness. Kidney dysfunction frequently leads to fluid retention, where excess fluid accumulates in various parts of the body, including the lungs. This fluid buildup, known as pulmonary edema, further impairs breathing, causing a sensation of shortness of breath and contributing to respiratory discomfort. Persistent bad breath. While bad breath can stem from various causes, persistent halitosis might be a sign of kidney failure. When the kidneys are not functioning optimally, waste products and toxins accumulate in the bloodstream, leading to an ammonia-like odor on breath. This occurs because the impaired kidneys fail to efficiently filter out urea, a byproduct of protein metabolism that is normally excreted in the urine. In cases of kidney dysfunction, elevated urea levels in the bloodstream can produce a distinctive and unpleasant odor, sometimes described as urine-like. This type of breath odor is often resistant to conventional remedies such as mints, gum, or regular dental hygiene practices. If persistent bad breath continues despite these efforts, it is important to consult with a healthcare professional to investigate potential underlying kidney issues. Lack of concentration. When the kidneys are not functioning properly, toxins and waste products that should be filtered out accumulate in the bloodstream. These accumulated toxins can eventually reach the brain, impairing cognitive function and making it difficult to concentrate. It's akin to trying to focus in a room with a strong, unpleasant odor, distracting and overwhelming. The kidneys serves as the body's natural waste management system, maintaining internal cleanliness. When their function deteriorates, waste builds up, affecting not just the body but also mental clarity. If you find yourself struggling with focus and concentration, it's advisable to consult a healthcare professional to evaluate kidney function and address any potential underlying issues. Difficulty sleeping. The kidneys plays a crucial role in hormone regulation, including the production of erythropoietin and renin. When kidney function declines, it can disrupt these hormonal balances, leading to issues such as insomnia. Additionally, kidney failure is often accompanied by the accumulation of waste products like urea and creatinine, which can create physical discomfort and further complicate the ability to fall and stay asleep. Imagine trying to sleep with an extremely full bladder. This comfort makes it challenging to get restful sleep. Similarly, the buildup of toxins in kidney failure can disrupt sleep patterns. Furthermore, individuals with kidney failure may also experience sleep apnea, a condition characterized by interrupted breathing during sleep, which further impairs the quality of rest. If sleep difficulties persist, it's important to consult with a healthcare provider to assess kidney health and explore potential solutions. Nausea and vomiting. When the kidneys are unable to effectively filter the blood, waste products such as urea, creatinine, and other toxins accumulate. This buildup can irritate the gastrointestinal system, leading to symptoms like nausea and vomiting. It's similar to the discomfort experienced when consuming spoiled food. Your stomach reacts by expelling the unwanted substances. Likewise, in kidney failure, the excess toxins in the bloodstream provoke nausea and can lead to vomiting. Additionally, kidney failure disrupts the balance of electrolytes in the body, which can further contribute to gastrointestinal distress and vomiting. If you experience persistent nausea and vomiting, it's important to consult a healthcare professional to evaluate kidney function and address any underlying issues. Itchy skin. Kidney failure can lead to persistent itchy skin due to the accumulation of waste products and toxins in the bloodstream. When the kidneys are unable to perform their filtering function effectively, waste materials such as urea and creatinine build up, causing a condition known as uremic pruritus. This condition manifests as an intense and often uncomfortable itchiness of the skin. Additionally, impaired kidney function disrupts the balance of electrolytes and minerals in the body, including calcium, phosphorus, and potassium. These imbalances can affect skin health, leading to dryness and further exacerbating the sensation of itching. The accumulation of toxins and the imbalance of essential minerals create a dual impact on the skin, contributing to persistent discomfort and irritation. If you experience chronic itchiness, it is advisable to seek medical evaluation to assess kidney function and manage these symptoms effectively. Muscle cramps. The kidneys are crucial in maintaining the body's electrolyte balance, which is essential for proper muscle function. When kidney functions declines, the regulation of these electrolytes such as potassium, calcium, and sodium becomes impaired. This imbalance can lead to muscle cramps, which are often painful and disruptive. Potassium, for instance, is a key mineral that plays a pivotal role in muscle contraction and relaxation. Under normal circumstances, the kidneys filter and excrete excess potassium to keep blood levels within a healthy range. However, when the kidneys are not functioning properly, potassium levels can rise abnormally, a condition known as hyperkalemia. Elevated potassium can trigger muscle cramp, weakness, and in severe cases, even cardiac arrhythmias, which can be life-threatening. Moreover, muscle cramps can also result from dehydration, a common issue in kidney failure, as well as uremia, a condition characterized by high levels of waste products like urea and creatinine in the blood due to impaired kidney filtration. Uremia not only affects muscle function but also contributes to a range of other symptoms, including nausea, fatigue, and confusion. Therefore, persistent muscle cramps in the context of kidney disease are a serious concern and should promote further medical evaluation to manage electrolyte levels and prevent complications. Swelling in the legs, ankles, and feet. When the kidneys are not functioning properly, their ability to effectively filter blood and manage fluid balance is compromised. This inefficiency results in the accumulation of fluids and waste products in the body. Consequently, these excess fluids can cause noticeable swelling in the legs, ankles, and feet. This is akin to the sensation of swelling and pooling of fluids in the legs after standing for an extended period, often resulting in a cankle appearance. In kidney failure, the kidneys are unable to adequately eliminate excess fluids from the body, leading to their accumulation in lower extremities. This fluid buildup results in swelling or edema, which can be persistent and bothersome. It's important to note that while swelling in these areas may be indicative of kidney issues, it is not a definitive diagnosis on its own. Other conditions can also cause similar symptoms. Therefore, if you experience significant or persistent swelling, it is crucial to consult a healthcare professional to determine the underlying cause and receive appropriate treatment. Frequent urination. When the kidneys are not functioning optimally, they struggle to maintain proper fluid balance in the body, which can result in an increased urge to urinate. Imagine embarking on a long road trip where you frequently search for the next gas station. Similarly, when the kidneys are impaired, your bladder continuously seeks relief, resulting in more frequent trips to the bathroom. In addition to increased urinary frequency, kidney failure can lead to other complications such as elevated urine production and difficulty controlling urination. These issues contribute to the need for more frequent bathroom breaks. The kidney's inability to properly filter and regulate fluids exacerbates the problem, causing persistent and uncomfortable urge to urinate. If you experience such symptoms, it is important to consult a healthcare provider to evaluate kidney function and identify the underlying cause. Pain in the kidney area. Kidney failure can cause discomfort in the upper back, just below the rib cage on either side of the spine. This pain may be constant or intermittent and is often accompanied by other symptoms such as fever, chills, nausea, and vomiting. If you are experiencing pain in this area and suspect it may be related to kidney issues, it's important to consult a medical professional. They will conduct a thorough physical examination, inquire about your symptoms, and perform diagnostic tests to identify the underlying cause and provide an accurate diagnosis and appropriate treatment. If you notice any of these symptoms, it's crucial not to panic but also not to ignore them. Early detection and treatment of kidney failure can prevent further damage and enhance your overall quality of life. The kidneys are essential for maintaining good health, so if you have any concerns, seek medical advice promptly. If you found this video informative, please let us know in the comments below. Don't forget to subscribe so you don't miss future videos, and remember to like and share. Stay healthy.